So in previous class, we are in the digestive system. Okay. So continue the digestive system diseases. Okay. So today we will discuss about an important topic, that is constipation. Okay. Constipation is a common term. Okay. So what is meant by constipation? So our digestive system do three works. One is digestion, another one is absorption, and third one is defecation. Defecation means removal of waste products or waste products from the body or waste material which are not helpful from the body after absorption. So it is the food we eat and it becomes smaller molecules and it is absorbed into the bloodstream. Okay, and some of the products which are not helpful for the body, okay, they are thrown back from the body. So we need some process. So in the digestive system, we have process that is defecation, means the removal of waste material, removal of waste products. Okay, so it is done by mostly large intestine. Okay, large intestine will absorb the water and it have other functions also. We'll discuss. We already discussed in anatomy and physiology. Okay, but in the large intestine, the main function is to evacuate the waste material from the body. Okay, it will stored in the rectum. Okay, rectum. In the rectum, the waste material is stored. Through the anus, the waste material is thrown out. So here we have the sphincters, two sphincters, internal and external sphincter. So internal sphincter is given signal to the brain when it is full. So brain will give information to the external sphincter. It is not in our control. It is in our control. So when the brain is activated, so we need to go to the bathroom to empty this rectum. Okay. So, but in constipation, what will happen? In constipation, the there are number of constipations types. It is depend upon the condition. So basically, here in the constipation, what will happen? The evacuation of stool is not happening properly. Okay. Means the whole amount of stool is not evacuated. You are getting we are getting s- some amount, okay, some amount of stool, and it is taking time properly, and you are giving stress because you did not want to give the stress to evacuate the stool. Okay, you are giving force stress means it is constipation. Okay, it is one of the thing of constipation, and other is if it is the stool become harder, this is also one of type of constipation. Okay, more stool is not getting out of the anus or from the rectum, and it is coming hard, very hard. Means whatever water material is there, large intestine is absorbed. primarily. A second is that the your brain is giving the signal to go to the washroom and you need to evacuate the stool, but you are ignoring. You are ignoring. You are holding the stool. So that the times get yeah the stool becomes harder. Okay, so this is one of the type of constipation. Okay, so what we have to do here? Some patients have acute constipation whenever they eat the food, like their food digestion is affected, so they are getting the constipation. Normal time they doesn't have constipation. Okay, but some patients have chronic, okay, acute acute constipation whenever they eat the food, oily food, okay, fatty food, okay, outside food, okay, and sometimes masala food. So all this food causing constipation, and sometimes decrease intake of water. These are causing acute constipation sometimes. But some patients have chronic constipation. Every time they have constipation because of decreased water intake, or habitually they are becoming chronic constipation. They are holding the stool. This is one of the main cause of chronic constipation. Okay, so it is become habitually holding the stool. That's the reason the patient having constipation. Okay. So you can divide into two types. Okay. You need to ask the patient if this is chronic constipation, it means his ability to evacuate the stool of large intestine is decreased. So there is a problem in large intestine. In the large intestine, we know that we have mucus. Okay. Is the mucus is there, and in we have the movement of large intestine. Okay. So the stool will go forward due to the mucus. Easily the uh, movement will happen. Okay, the stool will go forward. But when the mucus decreased, okay, what will happen? The ability of movement of large intestine is decreased. So then the stool will not go forward. It will need force to release from that area. Okay, you are giving stress force to the large intestine. Okay, so this is very important. So in the medical terminology, you need to go washroom or stool, evacuation of stool needed from minimum 3 to 4 times a week. This is natural. They are calling them natural. But in my opinion, 3 to 4 times in a week is not a good idea because you are eating food 3 times. Okay, it is digested, absorbed, and the waste material is getting stuck into the large intestine. Then how can you tell that 3 times or 4 times a week is a natural process? Uh, how they are on the length of the large intestine, due to the length of the large intestine is more than 11, 12 feet. Okay? So you can have the ability to store the stool minimum 1 to 2 days. So that that is the reason they are telling that. But You need to go to evacuate the stool daily once daily is a natural and minimum thing. If you are doing two times, it is also not natural. No issues. More than two times, it is the issue. You can check up. Or daily once or twice is a natural process. Means weekly 10 to 12 times is a natural. No issues. Okay, then the large intestine, whole large intestine will be keeping its duty or doing his duty normal. So, what are the clinical features? How the patient appear in your clinic and tell about you, their symptoms. So, you need to ask the patient, or he will tell you clinical features. Clinical features. First is patient have flatulence, gases. It is very important because the waste material which is stored in the large intestine will produce numerous gases, okay, which sometimes more smell will come. Okay. So this is the first question you can ask the patient. And we have discomfort in abdomen. Discomfort in abdomen. His second clinical feature, and his stomach become harder because you need to check the stomach, examine the stomach. There is tightness or hardness in the stomach. I need to ask the patient. And sometimes in severe condition, the patient have abdominal pain due to the constipation. And these are the rare conditions in the severe condition. And sometimes vomiting, nausea in severe cases. If the patient is not doing uh, stool from past 1 week, 10 days, 15 days, this case will also will come. At that time, what we have to do? So here, the clinical features. Now we talk about the treatment part, how to treat the constipation. So the basic cause is the large intestine. So we have to focus on large intestine. But if you go into the deeper, ask about the patient about digestion, then absorption, then deficit. These three steps are very, very important. What is digestion affected? Absorption is affected. If digestion and absorption is affected, then defecation is also affected. Okay, if these are not good, this is also not good. So you have to ask the patient about digestion. How is your digestion? How your stomach is breaking the iron molecules. When you are eating in roti, chapati, are chewing the food properly 20 to 30 times, minimum, or 16 times. You have to chew the food properly. This is the first answer you have to give. Then the stomach. How is stomach is making the molecules from larger to small? Okay. Is that all the molecules are released in the stomach? If not, then what happened? The hard molecules will go into the small intestine. They are unable to absorb. Then it will, if they are unable to absorb, the large intestine doesn't have the uh, function to absorb the things and digest the thing. Okay. So these are the questions you have to ask. Start with the digestion. So if the digestion is not proper, you need to add the digestive remedies. If the absorption is not there, you need to absorb the. Then if all these are okay, if the desiccation is not good, then is a problem in large intestine. So either problem in small stomach, small intestine, large intestine. If it is no problem in this, there is problem in the liver also sometimes, or pancreas, or gallbladder. We need to check those things. Okay. So here examination is very important, questioning is important. So you have to evaluate that problem. Okay. So now we'll discuss the treatment part of constipation. Okay. So basically in the electrohomeopathy, we have very important remedy about constipation, that is S-LAS. S-LAS is an anti-constipation remedy. This is one remedy, and with the C10 or S10, it will work very good, very good. Okay. And other remedies are work-1, work-2 also, because it is very good for intestinal wounds. Okay. Can add up. So here, these 3 to 4 remedies are very important for constipation. So you need to be in D4 only, because if the chronic condition D4, acute condition also, you need D4 or D5. So S-LAS in D4 directly, and second remedy is C10 plus S-LAS, D4 or D5. Third is S-LAS plus verb1 plus C10 sometimes, or fourth chronic condition S-LAS plus verb2 plus C10. D4. Okay, these are the step-by-step procedure. You can follow this. And sometimes if the stool becomes harder, you need to give enema. Okay, enema is given. Okay, enema is very important in some cases, like paralysis of the bladder, paralysis of traumatic injury of lumbar spine. So in that, what will happen? The nerve connection from the brain is cut it, so the bowel movement will not happen. So at that time, the patient needs enema also, enema. So we call PC enema. Okay. So there is a liquid pouch which will insert into the anus, and all the liquid will push into the anus. So it will smooth the stool. Okay, the stool will come outside with water. It will become water or semi-solid or liquid. So it will benefit the patient. It will evacuate the uh, stool from the anus. In the very chronic or very when the stool becomes very hard, we need to give easy enema sometimes. So this is all about the constipation. Sometimes the patient will have insomnia, depression. At that condition also needed F1 or sometimes F2 also. Okay. So you can add up other remedies also depend upon the condition. So I studied in American Neurology of Association that the main cause of depression or anxiety is one of the causes of depression, anxiety, or Alzheimer's, schizophrenia, Parkinson disease is one of the causes constipation. Okay, constipation is also one of the cause of this diseases. So we need to check that to avoid the constipation. We need to drink water properly, and we need to digest the food properly. We need to observe the food properly. Then the detoxification process will happen at that time. So these are the things we have to understood about constipation. Constipation will be treated. So in the 100%, 100 patient, 95% patients have constipation in chronic cases. Like we have rheumatoid arthritis, cervical, lumbar issue, osteoarthritis, any digestive problems, polycystic disease, everything. And take everyone, 95% patients have constipation. So I advise that we need to add this remedy initial 15 days, which will remove this constipation. Will not only remove constipation, it also remove the waste products from the body, toxic substance. Stress loss is not only anti-constipation remedy, it is antioxidant remedy also. Okay. So this is very, very important and need to understood. So here we are going to start the class. Any doubts? Kindly ask.